Welcome to another episode of Med Madness, where we delve deep into important medical topics to help you excel in your studies and practice. Today we're going to discuss trichotillomania, also known as hair pulling disorder. This is a condition that, although often overlooked, can have a significant impact on a patient's life. We'll explore the features, clinical examination findings, differential diagnosis, and treatment options for this disorder. To bring the topic to life, we'll also present a brief real-life case study toward the end of the episode. Next, let's discuss the main content of today's topic. Trichotillomania is a behavioral disorder characterized by recurrent compulsive hair pulling that results in noticeable hair loss. This disorder is more common than you might think, affecting about 1% to 2% of the population, with a higher prevalence in children and adolescent girls. Next, let's move on to the clinical features. Patients with trichotillomania exhibit recurrent episodes of hair pulling, often leading to irregular patches of hair loss. These patches are typically asymmetric, with hairs of varying lengths due to breakage at different points. Unlike other conditions that cause hair loss, trichotillomania does not involve inflammation or scarring of the scalp. This differentiates it from conditions such as alopecia areata, which presents with smooth, circular patches of complete hair loss, or tinea capitis, which features erythematous, scaly patches. The disorder can involve any area where hair grows, including the scalp, eyebrows, and eyelashes. Patients may feel embarrassed by their appearance and often go to great lengths to hide the hair loss, such as by wearing hats, wigs, or makeup. In some cases, the hair pulling behavior is done automatically without full awareness, while in others, it is preceded by tension and followed by a sense of relief. Now, let's explore the behavioral and psychological aspects of trichotillomania. This condition is often associated with significant distress. Patients may avoid social situations, work, or school to keep their hair loss hidden. Additionally, some individuals may engage in trichophagia, where they ingest the pulled hair, leading to potential complications such as trichobezoars, which can cause abdominal pain or bowel obstruction. When diagnosing trichotillomania, it's crucial to distinguish it from other causes of hair loss. Alopecia areata presents with smooth circular patches devoid of hair. Androgenetic alopecia in women leads to progressive thinning at the vertex and frontal hairline. Discoid lupus erythematosus manifests with erythematous, scaling plaques. Telogen effluvium causes diffuse hair thinning rather than discrete patches. Tinea capitis is a fungal infection presenting with scaly, erythematous patches and alopecia. Traction alopecia results from prolonged tension on the hair, commonly affecting the frontal and temporal scalp. Moving forward, let's talk about treatment. The mainstay of treatment for trichotillomania is cognitive behavioral therapy, particularly habit reversal therapy. This approach helps patients become aware of their hair-pulling behavior and develop strategies to replace it with healthier habits. To illustrate the impact of trichotillomania, let's consider a real-life case study. A 14-year-old girl was brought to the clinic by her mother, who was concerned about her daughter's patchy hair loss. On examination, the girl had irregular, asymmetric patches of hair loss on her scalp, with hair shafts of varying lengths. There were no signs of inflammation or scarring. The patient admitted to feeling an overwhelming urge to pull her hair whenever she felt anxious or stressed, followed by a temporary sense of relief. She had tried to stop on multiple occasions but found it difficult. After a thorough evaluation, she was diagnosed with trichotillomania and started on cognitive behavioral therapy, which helped her gradually reduce her hair-pulling behavior and regain control over her impulses. Finally, to summarize, trichotillomania is a challenging behavioral disorder that manifests with irregular patches of hair loss and significant emotional distress. Early diagnosis and intervention, particularly with cognitive behavioral therapy, are key to helping patients manage their symptoms effectively. As always, we encourage you to engage with our pre- and post-podcast quizzes and review the Anki flashcards we've prepared to reinforce your understanding of this topic. These tools are designed to help you retain the information and apply it in real-life scenarios. Thank you for tuning into Med Madness, and we'll see you in the next episode.